right, so today we're going to be diving into preventative healthcare.
Oh, cool.
Yeah, it should be really interesting. We're going to be looking at excerpts from a book called Pasted Text
Oh.
by Dr. Mahesh Hukmani.
Mm-hmm.
He's an eye specialist and inventor.
Doesn't he?
Yeah, and he makes some pretty bold claims
Really?
about how our current approach to preventative healthcare is not really doing enough, and proposes a new method that he thinks could be revolutionary using voice analysis.
Wow. So as an eye specialist, what do you think he's seeing in his practice that leads him to these conclusions?
Yeah, that's a great question. I mean, he's probably seen a lot of conditions that could have been,
Yeah.
prevented or at least detected earlier.
Right.
So let's start with his definition of preventative healthcare.
Okay.
So he basically defines it as preventing illness, identifying health risks, and promoting well-being.
So far, pretty straightforward.
Yeah, seems pretty basic. Right?
Yeah.
But then he goes on to emphasize the benefits. And this is where I think it gets really interesting.
Yeah.
Because he's not just talking about, feeling good.
Right.
He's talking about the potential to drastically reduce healthcare costs.
Oh, wow. And he actually put some numbers behind that.
Yeah.
He says preventative services could save trillions.
Trillions.
Yeah, trillions of dollars in healthcare costs over the next decade in the U.S. alone. Imagine what we could do with that money.
It's mind-boggling.
Yeah, funding research, expanding access to care.
Yeah.
It's huge.
Okay, so we're talking about saving lives and saving money.
Mm-hmm.
But where did the WHO guidelines fit into all of this?
Right.
Aren't they already focused on prevention?
They are to a certain extent.
Okay.
The World Health Organization obviously plays a vital role in global health and disease prevention.
Of course.
Their guidelines emphasize health as a fundamental human right.
Yeah.
And they advocate for things like promoting healthy lifestyles and universal health care coverage.
Right.
But Dr. Hukmani argues that even these guidelines
have limitations.
So he's saying the WHO is on the right track, but not going far enough.
Exactly. He thinks they're kind of putting a Band-Aid on a deeper problem.
Okay, so he's saying we need to dig deeper.
Yeah.
Go beyond just telling people to eat their veggies and hit the gym.
Exactly.
So what does he propose?
Well, he wants us to understand the root cause of disease.
Root cause analysis.
Yeah, he calls it root cause analysis and argues that to truly prevent illness, we need to understand where it comes from.
Interesting. Can you give me an example of what that would look like?
Sure. Imagine someone with chronic back pain.
Okay.
A traditional approach might focus on pain management through, medication or physical therapy. But root cause analysis would dig deeper.
Okay.
It might uncover that the back pain stems from, say, a sedentary job.
Oh, right.
Poor posture.
Yeah.
Even unresolved emotional stress.
Wow. That makes a lot of sense.
So you're looking beyond just the surface symptoms to figure out what's really going on? Okay, and here's where Dr. Hukmani throws in his curveball.
Oh.
He believes voice analysis could be the key to unlocking this deeper level of understanding.
Wait, voice analysis, how could that possibly tell us about the root cause of disease?
I know it sounds crazy, but he argues that our voices are incredibly sensitive instruments.
Oh.
Think about how your voice changes when you're tired, stressed, excited.
Right.
Those subtle shifts in tone and pitch, rhythm even,
Oh, wow.
can reflect our internal state, both physically and emotionally.
I see.
So he's saying our voices can reveal things about our health that we might not even be aware of.
So it's like our voice is kind of giving us clues that we don't even realize.
And he believes that these vocal changes can occur long before any physical symptoms appear.
Really?
Yeah. So he envisions using AI and machine learning to analyze voice recordings, looking for patterns and anomalies that could indicate the early stages of disease.
So it's like having a high-tech detective.
Yes.
Listening to our voices.
Picking up on clues that we wouldn't even notice.
That's incredible.
I know, it's pretty wild.
Is there any evidence that this kind of voice analysis actually works?
That is a great question, and one that we will explore further in the next part of our deep dive.
Okay, great.
But before we get there, let's unpack what Dr. Hukmani sees as the shortcomings of the current preventative healthcare system.
All right, let's do it. I'm ready to hear what he has to say.
Okay.
So how does this voice analysis actually work?
Yeah, how can you tell anything about a person's health just by listening to their voice?
Well, he points out that our voices are incredibly complex instruments.
Yeah.
They're influenced not just by our vocal cords, but also by our breathing, muscle control, even our emotional state.
Oh, wow.
And he suggests that changes in things like tone and pitch, rhythm, even the tiny little pauses in our speech can provide insights into what's happening inside our bodies.
So it's not just about what we're saying, but how we're saying it.
Exactly. And Dr. Hukmani proposes that artificial intelligence
Okay.
and machine learning algorithms could be trained to analyze voice recordings and detect patterns that are associated with specific health conditions.
So we're talking about AI that can listen to our voices.
Right.
And potentially flag health concerns before we even have symptoms.
Potentially, yes.
That sounds like something out of a sci-fi movie.
It does a little bit, right?
Yeah.
But there's actually quite a bit of research emerging in this area.
Silly.
Yeah. For example, some studies have shown that AI can detect early signs of Parkinson's disease.
Wow.
By analyzing changes in vocal tremor and speech patterns.
That's incredible. So this isn't just theory.
Yeah.
There's real science behind it.
Yeah, and the potential applications are huge.
Like what could you use it for?
Well, Dr. Hukmani envisions a future where voice analysis could be used as a screening tool.
Okay.
For a whole range of conditions.
Like what kind of conditions?
From heart disease to mental health disorders.
That would be amazing.
Imagine being able to just get a quick health check.
Yeah.
Just by talking into your smartphone.
Yeah, exactly. So early detection is key.
It is.
To effective treatment.
Absolutely. And this could really empower people to take control of their own health.
Yeah.
And seek medical attention before a condition becomes serious.
That's great. But wouldn't that lead to a lot of false positives?
It's a good point. It's definitely something that researchers are thinking about and working to address.
Yeah, because people might start freaking out over every little sniffle or cough.
Right.
If their phone tells them they might be sick.
Right. So the goal is to develop algorithms that are very accurate.
Okay.
So they can tell the difference between normal variations in our voices and the changes that might actually indicate a problem.
Okay, that makes sense.
So it's still early days for this technology.
Yeah.
But the potential is huge.
Definitely. But even if this voice analysis thing does become a reality, it's not about replacing traditional methods of prevention and diagnosis, is it?
No, I don't think so.
So we're not going to throw out our annual checkups and screenings.
Not at all. Dr. Hukmani sees voice analysis as a complementary tool.
Okay.
Another layer of insight
Right.
that can work alongside existing methods.
So it's like an early warning system.
Exactly. It can help us identify potential issues and seek further investigation when we need to.
Okay, so it's not a replacement. It's more like a powerful addition to our healthcare toolkit.
I think that's a good way to put it.
And the implications go beyond just individual health.
Right.
Imagine what you could do with this for public health initiatives.
Yeah.
You could use voice analysis to track the spread of infectious diseases or identify health trends within populations.
It's a really interesting thought. It could change how we approach healthcare on a global scale.
Absolutely.
Yeah.
But for now, let's get back to Dr. Hukmani's critique of the current preventative healthcare system.
Okay.
He seems to think that we're missing something crucial.
He argues that the current system often focuses on managing symptoms rather than addressing the root causes of disease.
So it's like we're putting a Band-Aid on a bullet wound.
Yeah, that's a good way to put it.
He believes that we need to shift our focus from just treating symptoms to understanding what's actually causing the illness in the first place.
And this is where his concept of root cause analysis comes in.
Right. We talked about that earlier. He's saying we need to dig deeper, look beyond the surface.
Yeah.
But how do we actually do that?
Well, he suggests that we need to consider the connection between our minds and bodies.
Okay.
He believes that our thoughts, emotions, and beliefs can have a big impact on our physical well-being.
So it's not just about our physical health. It's about our mental and emotional well-being, too.
Exactly.
And there's a lot of research on the mind-body connection, right?
There is.
How stress and trauma, even negative thinking, can contribute to physical health problems.
It's all connected.
So if we're constantly stressed or anxious, it can actually make us physically sick.
That's the idea. And it makes sense when you think about it.
Yeah.
Stress can cause headaches, muscle tension, digestive problems.
Right.
Dr. Hukmani argues that this mind-body connection goes much deeper than we realize.
Okay.
And that it's often overlooked in traditional healthcare.
So how does he suggest we address this mind-body connection, like practically speaking?
He advocates for a more holistic approach to wellness.
Oh, yeah?
He encourages people to explore practices like mindfulness meditation and stress reduction techniques.
So things that help us relax and manage stress.
Exactly. And he sees these practices as part of a preventative care plan.
So it's not just about going to the doctor when we're sick.
You're right.
It's about taking care of ourselves in a more holistic way.
Exactly. It's about looking at the whole person.
And this is kind of like what's called integrative medicine, right?
That is.
Combining conventional medical practices with these other therapies that focus on the whole person.
Exactly. Dr. Hukmani seems to be aligning with this movement towards a more integrated and holistic approach.
Yeah, it's about looking beyond just the physical body and considering the mental and emotional aspects of health as well.
It's all connected.
This is giving you a lot to think about.
You too.
But before we get too deep into that, I think we should wrap up our discussion of Dr. Hukmani's ideas in the final part of our deep dive.
Okay, sounds good.
We still need to explore what all of this means for the future of healthcare. It's amazing to think about all this stuff about voice analysis and this mind-body connection.
Yeah, it really makes you think.
And it seems like Dr. Hukmani's really pushing us to kind of rethink how we view preventative healthcare.
He is. And, I was thinking about his background as an eye specialist.
Oh, yeah. How do you think that shaped his perspective?
Well, think about the conditions he treats, glaucoma, macular degeneration, diabetic retinopathy.
Right.
These are often chronic conditions with really serious consequences. And a lot of them are linked to lifestyle factors and underlying health issues.
That's true. Yeah. I remember reading that diabetes is a leading cause of blindness.
Exactly. So you can see how Dr. Hukmani, having seen the effects of these preventable conditions, might be really motivated to find a better way.
Yeah.
He's not just content with managing symptoms.
Right.
He wants to get to the root of the problem.
Yeah. It's like he's saying, I've seen what happens
when
these diseases aren't prevented.
Exactly.
And I'm not going to just stand by and watch.
And that passion really comes through in his writing.
Yeah.
He's not just giving us dry medical facts.
Right.
He's making a case for a real change in how we think about health and wellness.
So what are the implications of all of this?
Well,
if we really take this root cause analysis idea seriously, what does that mean for how we approach preventative health care?
I think it means we need to go beyond just, annual checkups and screenings.
Yep.
Don't get me wrong, those are still important.
Yeah.
But they're not the whole picture.
It's like checking the oil in your car, but never actually looking under the hood.
Exactly. Dr. Hukmani's urging us to open the hood, to really look at how our physical, mental, and emotional states are all connected.
So it's about understanding that our health isn't just about our physical bodies.
Right.
It's about everything.
It's about our whole being.
Yeah, and realizing that everything we do, what we eat, how we move, how we handle stress, it all affects our overall well-being.
It's like a whole ecosystem, right?
Yeah.
Everything's connected.
And just like an ecosystem, our bodies are always trying to find balance.
Exactly.
And when something disrupts that balance, whether it's something external like pollution or something internal like stress, that's when we start to get sick.
That's when disease can take hold.
So if we can maintain that balance, take care of our minds and bodies, we can prevent disease from even starting.
That's the idea.
It's about being proactive instead of reactive.
Exactly.
And it's about empowering people to take control of their own health.
Absolutely.
Which brings us back to those practices he talked about.
Right.
Mindfulness, meditation, stress reduction.
All of those things that help us cultivate that balance.
Yeah.
Become more aware of our bodies and minds.
It's like learning to listen to our bodies.
Right, to those subtle signals that we might not even notice otherwise.
And realizing that being well isn't just about avoiding illness.
No.
It's about living a life that's full of joy and energy.
It's about thriving,
Yeah.
not just surviving.
Exactly. And I think that's really what Dr. Hukmani's trying to say.
Yeah.
It's a call to action, to rethink how we see our health and embrace a more holistic approach to well-being.
Well, listeners, our deep dive into Dr. Hukmani's work has taken us on quite a journey. We've explored some really cutting-edge technology with voice analysis, learned about the mind-body connection, and considered what a more holistic approach to healthcare could look like.
It's been fascinating. It really has. And it leaves us with some big questions.
Definitely.
Could voice analysis actually change how we detect and prevent disease? Can we live longer, healthier, and happier lives by embracing this more holistic approach to wellness?
Those are the questions we need to be asking.
They are, and we encourage you to keep exploring these ideas.
Yeah, keep thinking about it.
And if you want to learn more, be sure to check out Dr. Hukmani's book, Pasted Text.
It's a really good read.
It really is. It challenges us to rethink what we know about health and wellness.
Definitely.
Until next time, keep asking those big questions and keep diving deep into the world of knowledge.